Howdy YouTube family, it's Bolt CRNA coming to you again with another day's topic. Today we're going to talk about what kind of job you can get as a CRNA when you're graduating. When it's that time you're getting close to the end of the third year, you're looking at jobs out there, you're looking at the market and you're trying to figure out what kind of jobs can I actually get as a CRNA, what's out there. So let's talk about that today. There's a lot of different areas that you can work in as a CRNA. Some people have the misconception that as an anesthesia provider, you just go to a hospital and you only work in one hospital, and that's essentially what you do is do surgeries for major hospitals. That's not true. There's lots of different settings that you can work in depending on what your interests are and what type of lifestyle you're looking for. So let's start with our first place. You can work at large academic centers, like big academic hospitals. Usually these are name type hospitals that people are familiar with, Johns Hopkins, Stanford, Vanderbilt, Emory. These are big university facilities that have a lot of training and teaching going on. That's going to be a very unique workplace environment for any anesthesia provider, but specifically CRNAs. In these environments, you're almost always going to be working in a care team, an anesthesia care team. And what that means is you're going to be working with a physician anesthesiologist. In these settings, a lot of times they do what's called medical direction billing. And when you bill for medical direction, that is where you can only have one physician for 4 CRNAs. And they all work on a team together. And so to work in this model and to bill for this kind of model, for Medicare and Medicaid, to allow you to bill for this model, you have to obey the 7 TEFRA laws. That's spelled T-E-F-R-A. And I'll probably put a link in the description below to kind of give you an idea of the TEFRA laws. But essentially, it's 7 different things that Medicare and Medicaid says in these settings. If you bill for medical direction, they make sure that you meet all 7 of these things. Now, luckily for CRNAs, it's not really something that we have to meet or do. It's almost exclusively 7 things that the physician who's working with the 4 CRNAs has to do, because the physician is allowed to bill for 50% of the total money made for each case. They're allowed to bill 50% of each of these. So if they're running 4 cases with 4 CRNAs, they're billing 50% off each of those 4 cases. That means they're making 200% salary. So Medicare and Medicaid says, hey, if you're going to make 200% salary, you're going to do 7 of these laws that they put on physicians back in 1982. I believe they came up with this. And so anyway, part of this is going to be that they have to be involved in the pre-op. They have to be in the room when induction for anesthesia happens. They have to be in the room when anesthesia is ending, what's called emergence or extubation. They have to be in the room. They have to be available and checking in for high points throughout the case of any time that they're needed or assistance needed or anything like that. So there's a couple other things, but those are like the high points of what it involves. But what that means in those academic settings is it's a very different workflow that you're going to have to work within if you work in those big academic centers. Some people love that setting. Some people really enjoy that kind of very tightly collaborative work environment where the patient always has got both of you on board at all times involved. Some people like it, some people don't. So that's just something you have to figure out for yourself, what you prefer. The other thing about working in big academic hospitals is they will have big cases. There's going to be unique cases. There's going to be cases with patients that have unusual pathophysiology and research type things going on. There's a lot of specialization that goes on in these places. So you'll see patients that you won't see other places. They come specifically to this hospital. They may have been referred out from hours away and have drove into this facility to get this surgery done with this particular surgeon because they have a very bizarre form of bone cancer or something like that. So you see a lot more of that in the academic centers. Another thing unique to academic centers is there will be lots of physician resident trainees. There will be lots of medical students rotating through there. There'll be students of all kinds, pharmacy students, CRNA students, everybody. But typically, these academic centers are really focused on physician training. That's their main goal and focus. That's what they usually have a robust residency program, many residencies and fellowships, and so you will have lots and lots of physician trainees there and medical students there. So as a CRNA, you have to go into a work environment like that knowing that you're going to be working around trainees sometimes. It's not necessarily your direct job to have to train them, but there'll be times where they may be in a room with you, they may need to intubate and you may have to assist. There may be times that there is learning opportunities that come up. So there is just that kind of environment you have to be okay with being in, where there are trainees, lots of them around, and not just anesthesia trainees, but like surgical trainees. You'll have surgical residents. So as a CRNA, you have to be okay with the fact that it may take quite a long time to close up a wound, and you may have to run your gas and run your anesthetic much longer than you normally would because it's taking a long time to close because the residents, are not as fast as the physicians already out of training. The other thing about your practice is because it's usually a very strict care team model where they obey all of these 7 TEFRA laws and there's lots of engagement and involvement by the physician in these cases. A lot of times that means the CRNAs don't do every single aspect of anesthesia, because the physician is already, there, and they may do that aspect for you. For instance, like peripheral nerve blocks, central lines, certain things like that. They may do those while you're in a case, because they're not in a case, they're not doing a case. They're there as a resource for you while you're doing a case, so it makes more sense for them to do the block in pre-op. The other aspect of academic centers is there's lots of, like I said, residents and fellowships and people. So they need these for their numbers. They need blocks for their training and their numbers. So oftentimes they will actually be the ones who do the blocks because that's their whole purpose of being there for the day is maybe just training on blocks. So they find all the blocks and do them. So it's a lot more rare to do peripheral nerve blocks and a lot of other things as a CRNA in these kind of centers. Now on to salary and benefits. A lot of times the benefits are pretty good at these academic places. Sometimes they offer free tuition for your kids, maybe to go to their school. They may offer a really good health insurance policy plan through the university health system. They usually offer pretty good work-life balance for CRNAs. Usually you don't have to take much call at these places, and you typically can get out at a certain time of day. If you only want to work 5/8s or 4/10s, you can usually work those shifts, and usually at the dot at the time that you're supposed to be getting out, they usually are pretty good about finding somebody to relieve you and get you out of there. It's not typical for you to have to be stuck there a long time past when you were supposed to have left. They also have people, because you work in a pretty collaborative team with a physician that only has at max 4 CRNAs working with them, you almost always will get like a lunch break. There's either a lunch person to break you or the physician will come and break you. And so there's a lot more of I would say it's a much more of a lifestyle type position working in these academic hospitals where you have a really good work-life balance. So the next thing is a large regional hospital. These are usually hospitals in cities and stuff that may be down the road from the bigger academic center, but they're not specific to academic centers. They're not dedicated to training. They're more of like private hospitals or community hospitals. And they're usually large, and you may have major trauma centers like this. They may do a lot of complex cases. You'll probably still have the same type of workflow environment with physicians in these bigger hospitals like this, where it's like a 4-to-1 medical direction billing type scenario. So all of that will probably be very similar. Some of these places might have more autonomy than the academic centers. Other times they may be the same level of autonomy. It really just depends on the hospital. There's some variability that you can see from place to place like this. And sometimes in these locations you might have to take call, you might have to work the occasional weekend. They may not have as much dedicated staff for breaks and things like that. So it's a little bit more work, and the pay is usually pretty moderate. Then that brings us to our small and mid-size hospitals. So these are usually your community hospitals in the suburbs or maybe in small rural towns. These may also be like a care team, but it may be like a loose supervision type care team, which loose supervision, that's essentially a billing term, which just means it can be one physician for many CRNAs, as many as they really want. And so it's essentially more autonomy. You may work in a group that's actually collaborative, where there is no, it's considered what's called QZ billing, which means you just bill independently as a CRNA, and the physician, if they work in the group too, they bill independently themselves, and everyone just does their own cases, and you help each other out if you need it, but it's not any particular person, involved in each other's cases. These smaller settings oftentimes don't have people who are dedicated to give breaks and lunches. You'll catch your lunch in between cases. You might only get 15 minutes in between a case to quickly scarf down something. So it's not as much lifestyle as, say, the academic centers may be. You may be working harder, you may work longer hours. Oftentimes you're assigned a room for the day, and if that room goes past 5 p.m. or something and you wanted to leave at 5 p.m., you have to stay because there's not anyone else to take your cases for you. So you just stay and you continue working till your cases are done. It's almost a guarantee that you are going to be taking call in these smaller facilities because they just don't have the extra staff dedicated to just those people taking call and stuff. So pretty much everyone has to pull their weight, and all the team members have to divvy up the call together. And this, of course, goes for weekend shifts too. So you probably are going to have to divvy up who's taking the weekend call and share that. The other benefit of these types of places is there's lots of autonomy. So as a CRNA, you can find full autonomy. It can be a CRNA only group. It can be a mixed collaborative group where you bill independently. And you just have lots of autonomy here. You can do all your own blocks, you do all your own cases. You most often are not going to be doing very complex cases. They're usually more common, what was considered bread and butter surgery type cases. And you'll probably be covering OB in these types of smaller community hospitals as well. You probably won't be doing open heart surgeries or craniotomies and like neurosurgeries and stuff, but in general, you'll be doing a smattering of everything else, a little bit of peds, a little bit of OBGYN, a little bit of orthopedics, a little bit of eye, a little bit of general surgery. So those are our general hospital settings that typically anesthesia works in. As you branch outside of the hospitals, then you have other types of settings like outpatient surgical centers, outpatient eye centers, outpatient GI centers, outpatient plastic surgery centers, and outpatient pediatric dental surgery centers. So these are all going to be similar in the sense that pretty much they run Monday through Friday, 7 to 5 or something like that, 7 to 3. They're not, it's very cushy type hours. They're not going to work at night. They're not going to work on the weekends. They're not going to work holidays. The patients should be healthy. Now that should, sometimes people slip through the cracks in these places, and that's when it really takes a skilled CRNA to handle complicated issues that arise in these outpatient surgical centers. But in general, your patients should be fairly healthy. They shouldn't have any very complicated pathophysiology going on or health risk factors that put them at high risk, because they would not be appropriate for outpatient surgery. If that was the case, they should go to the hospital. So yeah, your patient should be typically able to handle a general anesthetic and be able to go home the same day. Your eye centers are going to be a lot of just IV sedation medicines for quick eye surgeries, cataracts, things like that. Patients go home very easily and quickly. Those are usually not complicated. GI centers, upper scopes and lower scopes, people just do those all day, and typically those are healthier people. You shouldn't have too much complications with that, although I will say GI, you can run into some hairy situations in GI, so I don't recommend new graduates trying to go straight to a GI center outpatient somewhere. Pediatric dental clinics are often going to be some sedation and stuff for the dentist who's going to be doing a little bit more invasive type procedures on kids and things like that, that is more than a cavity filling and things. So also I would say pediatrics is not somewhere I would try and go as a new graduate. I would advise people to have more experience and go into that role after you've done a few years of hospital practice and had a lot of troubleshooting experience with issues in the hospital, because in those settings things can go wrong very quickly, and with pediatric airways, you definitely don't want to be a novice or someone who's just fresh into practice. You want to know that you can handle a lot of situations that come your way, because oftentimes in these pediatric centers, it's just one anesthesia provider solo, like per day. Because it's only certain days a week. It's usually part-time. Like the dentist may do 2 days of surgery per week, and they only need anesthesia for those 2 days, and they usually just need one of you there. So you're usually there by yourself with your stuff and your supplies. So you really want to be pretty skilled at handling that. There have been pediatric deaths with complications with dental stuff in the past. So yeah, these are not things that you want to jump into lightheartedly. And then the outpatient plastic surgery is a little bit unique because a lot of times those are private pay types of patients, and places like Los Angeles and Miami, there's tons of these outpatient surgical plastic surgery offices. I have some friends that work in these types of offices. It's a little unique that your anesthetics you give are usually for cosmetic reasons, and these patients usually have a little bit of a expectation of a concierge type service for your anesthetics, and you're expected to be giving them a very tailored to their preference type of anesthetic that they will feel pleasant about. So you have to take that more into concerns when you're working in outpatient private pay plastic surgery offices, and your clientele may be of a certain stature and expectations. And if any of you remember Joan Rivers, when a physician anesthesiologist did not have succinylcholine available while she was having some type of procedure done, I believe she laryngospasmed and she died because this physician anesthesiologist did not have succinylcholine on hand in the clinic. And of course he was the only one there, I believe, and there was no way to break the laryngospasm, and she died. So those are some complications that can come up in plastic surgery that happens, that cases have happened in these outpatient centers. So again, I don't really recommend people going into like small solo plastic surgery places right out of training. These are probably things that you should be doing after you've had a few years of experience and gotten a really solid footing on how to troubleshoot issues and how to handle things all on your own. Well, all right, guys, I have talked all about the different types of areas. If I've forgotten about a certain area that a CRNA can work in, of course, the military is a whole different field, a whole different, it is anesthesia, but it's essentially all of these types of anesthesia, but you do it for the military now, and you might get deployed. And of course, your salary and stuff is different in that sense. But yeah, if there's anything else that I've left out, comment down below and let me know. Let me know what you guys think is your favorite area to work in as a CRNA. If you want to become a CRNA, what kind of job do you hope to have? Where would you like to work? I've worked in big academic centers. I have worked in moderate-sized community hospitals, and I've worked in small, rural, pretty much independent CRNA-ran hospitals too. So those are the experiences I've had so far, and I hope to continue to grow and to see more different types of settings and get experience in lots of different stuff. Thanks guys for listening, and until next time, that's Bolt out.